So today we're going to go over teaching someone how to do a Foley.
So Nurse Janet here is going to teach my nursing student Amber on how to properly insert a Foley catheter on a female.
So I've already asked Amber, the student nurse, to go over the procedure with the patient and to see if the patient had any questions.
So at this point I've verified first name, last name, date of birth, and I've explained the procedure, what we're going to do, and the reason why we're going to do it.
Okay, so we're going to lower the head of the bed to ideally flat or to the comfort of the patient. And in this case, we're going to position the patient in the dorsal recumbent, which is lying on the back. The knees are flexed and thighs are relaxed. Okay. So now apply clean.
So first we're going to actually palpate the bladder for distension. In this particular patient, we already did a bladder scan and noted that the bladder was full and needed to be catheterized. So this patient is not that clean, so before we even start any part of the sterile procedure, I know from school that we are supposed to clean them. So make sure that the vagina or penis is free of debris. So what we're going to do is place a chucks underneath the patient, and in this case there's a chuck here. So we'll do that, chucks under the patient. We're going to take water and soap. In the hospital we would use a washcloth. And we're going to cleanse the perineal area and get another one. We're going to cleanse, another one, cleanse, and then another one. Cleanse right down the middle. And then we'll pat dry the patient.
Make sure dry.
Okay. And then I'm going to go ahead and change my gloves just because I just did a procedure when cleaning the patient. Okay, what next?
So now we can grab the catheter. We can open it from the outer packaging.
And then Mrs. Jones, I'm just going to place the packaging below or in between on the bed between your legs so it's easy to access.
Or for garbage.
Oh, yeah.
Just for any garbage, put it in the bed.
Okay. So here we are, and there's gloves in the kit.
So now try to open that kit with the sterile technique. Very good, sterile technique. Just grab the edges. So there should be a pair of sterile gloves right on top.
Right on top there. In which case,
yeah, go ahead and grab that and place that over the genital area. Oh, that's the absorbent one.
That's okay. Well,
Where's the other one? Oh, the other one's right there.
So these are my sterile gloves, which I'm going to place here on the desktop. And then this is the cover for the there we go. And either way you put it, whether you do it long ways or sideways, just so long as you only touch the outer parts of the, there you go. So now, we're going to go ahead and don our sterile gloves.
Right. There you go. That's the left.
Yeah, I do left first.
Oh, you do? Okay.
This is never pretty.
Doing great, Amber.
Thank you very much.
Don't forget, we need to add this to your psychomotor log so Meravit can see your skills today.
Very good. Okay, I will do that.
Great.
Always.
Good job.
As always, they are never where they're supposed to be. Okay, making sure not to touch the inside.
Great. So
Here
now
I
that
am.
you have your sterile gloves on, go ahead and open the lubricant packet. Or you might want to get some of that stuff. Yeah, go ahead and open
Yep,
the
so
lubricant
we're going to utilize this whole entire space. So we've got our lube here. What I'm going to do at this point is I'm going to, what's the technique when they tore the end of the blue off and put it in the lube first? But then you have to take the whole sleeve off anyway. Take the whole sleeve off? Okay, great. So she's teaching me.
So open the lube.
So we're going to get our lube and we're going to squirt it in here. And then we're going to open up our iodine packet like that. Now once I touch the patient, this hand is dirty, so everything else has to be ready. So I've got my iodine packets ready to go. I'm going to go ahead and take this out and make sure I don't touch anything or turn my back on my sterile field. And then I've also got my
Go ahead and connect that.
water, which I'm going to connect now. So everything's sterile here. I'm going to connect to the tubing. There we go. Okay, so I've explained the procedure to the patient. I'm taking my iodine. Now this hand is going to be dirty. So I'm going to hold the patient here. I've got the iodine. Do outside, toss, iodine, outside, toss, iodine. Spread the labia. Straight down the middle. Toss.
Now keep that open.
This hand is going to stay here. So with this, I'm actually going to can.
Yes, you could have on.
Yep.
Turn it off.
That's okay. This is like something as a student we forget to do. Okay, dip in the lube. I'll take that off when I take the lube off. Dip it in the lube very generously. Then you're going to take this and advance it into the patient. And you're going to advance this into the patient all the way until you see urine return. So you're going to advance it, advance it, advance it, advance it. There I have urine return. You go a little bit more. And then check on the patient. How are you feeling? You're doing okay? Okay, good. Then you're going to push all the fluid in like that. Make sure there's no discomfort. And then you're going to give, so you push all your fluid in. Then you can take your syringe off. And then you're going to give a little tug. You're going to tug and make sure that it's in place. Then this hand is dirty. So
You can let go now.
yes, I can actually let go, but I'm just going to go ahead. Yeah, actually I am. I'm going to go like this. I'm going to take the tape. I can even go like this because it's dirty. You can put another glove on. Now I'm done with that. Okay, so now I'm going to secure the line to the patient's leg. We're going to hang the bag, oh, not like that. We're going to hang the bag down below, but not on the side rail because it'll go up and down. And then make sure the patient's comfortable, and I can go ahead and get rid of all my debris. Now there's a couple things that Janet wants to talk about when finding the right place and making sure that you're in the right place. The wink. Yeah.
So if, while inserting the catheter and you do not see any urine flow coming out and the catheter is somewhat quite a bit advanced in, you probably are not in the urethral meatus, so leave the tubing there because you're probably in the vagina. Grab another catheter kit and then try again. And a good helpful tip is, especially with more obese patients, really spreading the labia, and you want to look for that wink is what you're looking for. So you can try again with the first attempt tubing in. You can see kind of where you're at and then go maybe a little bit above to try to find that urethral meatus, and then you try again. And then another thing I want to note, Amber, for male patients, all the steps are the same for sterility, and the concepts are still the same. But with male patients, just remember that when you grab the shaft of the penis, that it's important to keep the penis at a 90-degree angle towards the patient because the catheter insertion goes a little bit more easily with that position.
And in that position, I found that you don't have as much resistance from the prostate in that 90-degree angle.
And if you do have some resistance, or the male patient is telling you that it hurts a lot, you need to stop. Ask the patient to do some techniques to relax, such as breathing, and then try again. And if the patient is still having, the male patient is still having a lot of pain, you might need to reassess the situation because the patient could have some prostate issues or some other obstructive issue. So just because this procedure should not be painful.
Right. Okay, and then for de-seeing the Foley, it's basically the simplest thing that you can do. You just explain that it's not going to hurt. You can tell the patient to take a breath when you remove the tube, but you just make sure that you enter the room with your syringe because you're going to need to. I would recommend going with a syringe above 10 cc's to take it out because then once you hit the air, if you get a 50 cc syringe or maybe even a 30 cc syringe, you take the water out, and you've got your 10, and then you meet resistance, you know it's all done. So you take the water out, you have your chuck ready, and then you just wind it into the chuck. Make sure you don't want to flick urine on yourself. So you have your urine there. Make sure you've checked your orders. You've got your urine there. I meant chucks there. And then you're going to just tell the patient to take a breath. And as you pull it out, you coil it in the chucks like that. And then you can throw the whole system away. And make sure your patient's comfortable. And make sure that we check on them at least every hour or 2 hours just to make sure that they don't have a need to go to the bathroom.
So Amber, do you think you can remember all those steps? Do you think that's something you could remember?
I think maybe, but I think we might need to do something fun just so it sticks.
Amber, drop that beat.